Hello, this is Jody Dampier Moore, and I'm going to do a mini presentation on tuberculosis. And this information is coming from the CDC. So, what is tuberculosis? Tuberculosis is caused by bacteria that spread from person to person through microscopic droplets released into the air. This can happen when someone with untreated active form of tuberculosis coughs, sneezes, speaks, spits, laughs, or sings. So the signs and symptoms of tuberculosis is coughing that lasts 3 or more weeks, coughing up blood, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, and or loss of appetite. So the people at risk for tuberculosis are persons living in close contact with a person exposed to contagious cases of TB, foreign-born persons, including children who have immigrated within the last 5 years from areas that have a high TB incidence, residents and employees of high-risk congregate settings such as prisons, nursing homes, homeless shelters, drug treatment facilities, and healthcare facilities, some medically underserved and low-income populations, infant, children, and adolescents exposed to adults in high-risk categories, persons who inject illicit drugs or any other identified high-risk substance abuse, healthcare workers who serve high-risk patients. So diagnosis. The most commonly used diagnostic tool for tuberculosis is a simple skin test, though blood tests are becoming more commonplace. Blood tests, imaging tests, and sputum tests are also used. So the blood test. They may be used to confirm or rule out latent or active tuberculosis. These tests use sophisticated technology to measure the immune system's reaction to the TB bacteria. The blood test may be useful if the patient's at a high risk of TB infection but have a negative response to the skin test, or if they recently received the BCG vaccine. The imaging test. If the patient has a positive skin test, the provider is likely to order a chest X-ray or a CT scan. This may show white spots in the lungs where the immune system has walled off the TB bacteria, or may reveal changes in the lungs caused by active tuberculosis. CT scans provide more detailed images than X-ray. The sputum test. If the chest X-ray shows signs of tuberculosis, the provider may take samples of the sputum that come up when the patient coughs. The samples are tested for TB bacteria. Sputum samples can also be used to test for drug-resistant strains of TB. This helps the provider choose the medications that are most likely to work. Some common TB drugs are rifampin and pyrazinamide. Also, remind the patient the importance of completing the entire medication regimen. So, adverse reactions to the medication. The patient should call the doctor immediately if the following occur: nausea or vomiting, loss of appetite, a yellow color to the skin, which is jaundice, dark urine, and a fever that lasts 3 or more days. And again, please remind the patient to complete their medication regimen.